Anaphylaxis, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Anaphylaxis, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of anaphylaxis. Chapter 1. 1. What is the difference between anaphylactic shock and anaphylaxis? Anaphylactic shock is a complication of anaphylaxis. 2. What are the signs and symptoms of anaphylaxis? The signs and symptoms of anaphylaxis are swelling, difficulty in breathing, nausea, vomiting, stomach pain, hypotension, tachycardia, a weak pulse, dizziness, fainting, wheezing, clammy skin, pale skin, hives, itching, anxiety, confusion, loss of consciousness, etc. 3. What is tachycardia? Tachycardia is a rapid heart rate. 4. What happens to the blood pressure during anaphylaxis? Blood pressure drops during anaphylaxis. 5. What is hypotension? Hypotension is low blood pressure. 6. What is the optimal blood pressure? The optimal blood pressure is 120/80ths of a millimeter of mercury. 7. What is angioedema? Angioedema is swelling beneath the skin. 8. What causes difficulty in breathing in anaphylaxis? The narrowing of the airways causes difficulty in breathing in anaphylaxis. 9. What happens to the immune system during anaphylaxis? The immune system overreacts during anaphylaxis. 10. What is the function of the immune system? The immune system is the body's system of defense. Chapter 2. 1. What are the main causes of anaphylactic shock? The main causes of anaphylactic shock are food allergies, bites from insects, certain types of medications, etc. 2. What is an idiopathic anaphylaxis? An idiopathic anaphylaxis is an anaphylactic shock with an unknown trigger. 3. Can eating nuts trigger an anaphylactic reaction? Yes, eating nuts can trigger an anaphylactic reaction. 4. Can latex trigger an anaphylactic reaction? Yes, latex can trigger an anaphylactic reaction. 5. Can penicillin trigger an anaphylactic reaction? Yes, penicillin can trigger an anaphylactic reaction. 6. Give an example of a common insect bite that can cause an anaphylactic shock. A bee bite is an example of a common insect bite that can cause an anaphylactic shock. 7. Can asthma be a risk factor for anaphylaxis? Yes, asthma can be a risk factor for anaphylaxis. 8. Is having anaphylaxis in the past a risk factor for anaphylaxis? Yes, having anaphylaxis in the past is a risk factor for anaphylaxis. 9. Is it possible to have exercise-induced anaphylaxis? Yes, it is possible to have exercise-induced anaphylaxis. 10. What are antibodies? Antibodies are proteins that fight against diseases. 11. Antibodies are also called immunoglobulins. Chapter 3. 1. Can anaphylaxis also happen to children? Yes, anaphylaxis can also happen to children. 2. Could anaphylactic shock be fatal? Yes, anaphylactic shock could be fatal if it is not immediately treated. 3. Can anaphylaxis be prevented? Yes, anaphylaxis can be prevented. 4. How can anaphylaxis be prevented? Anaphylaxis can be prevented by allergy test, avoiding triggers, and using epinephrine autoinjector. 5. How is an anaphylactic shock treated? An anaphylactic shock can be treated by injecting epinephrine. 6. What ways can anaphylaxis be treated? Anaphylaxis can be treated by epinephrine, cortisone, antihistamines, bronchodilators, oxygen, etc. 7. What are antihistamines? Antihistamines are medications that treat allergic reactions. 8. What are corticosteroids? Corticosteroids are anti-inflammatory medications. 9. Epinephrine can also be called. Epinephrine can also be called adrenaline. 10. Does the body produce epinephrine? Yes, the body produces epinephrine. Chapter 4. 1. What gland produces epinephrine? The adrenal gland produces epinephrine. 2. What is tracheostomy? Tracheostomy is an emergency treatment that involves putting a tube into the trachea to allow breathing if the person cannot breathe. 3. Can anaphylactic shock lead to brain damage? Yes, anaphylactic shock can lead to brain damage. 4. Can anaphylactic shock lead to kidney failure? Yes, anaphylactic shock can lead to kidney failure. 5. Can anaphylactic shock lead to cardiogenic shock? Yes, anaphylactic shock can lead to cardiogenic shock. 6. What is cardiogenic shock? Cardiogenic shock is a shock that prevents the heart from pumping sufficient blood to the body. 7. Can anaphylactic shock lead to arrhythmias? Yes, anaphylactic shock can lead to arrhythmias. 8. What are arrhythmias? Arrhythmias are irregular heart rhythms. 9. Should a person go to the hospital or seek medical care after using epinephrine autoinjector and feels better? Yes, a person should immediately go to the hospital or seek medical care even after using an epinephrine autoinjector, because there could be a second reaction as soon as the effect of the epinephrine goes away. 10. What is a biphasic reaction? A biphasic reaction is a second reaction to an anaphylactic shock. 11. Can a biphasic anaphylaxis occur some days after the first anaphylaxis? Yes, biphasic anaphylaxis can occur days after the first anaphylaxis. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding anaphylaxis.